So welcome to week 10. Today we're focusing on safety, injury prevention, one of the most important topics in fitness as well. By understanding safety habits, now you'll be able to protect your body, prevent injuries, and set yourself up for long-term success. By the end of today's lesson, you should be able to identify the key components of personal safety and fitness, explain common causes of injuries and how to prevent them, demonstrate safe warm-up, cool-down, and equipment use, recognize signs of overheating, dehydration, and overuse injuries. So, safety matters for several reasons. So, injuries delay your fitness progression. Unsafe habits can become long-term problems. When you feel unsafe and when you feel safe and confident, you perform better. Preventing accidents. It makes physical activity more enjoyable. And then good technique and smart habits protect your body as well. So you have the two main types of injuries. So you have acute injuries, so sprains, strains, and fractures. And then you have the chronic overuse injuries, so tendonitis, stress fractures, shin splints. So just a quick question for the class, to just kind of get our brain thinking about this topic is what happens if someone increases activity too fast? Um, Sometimes what happens is that they may risk overuse injuries because the body doesn't have enough time to adapt um, to that type of progression. So that's why it's always important to not always rush in, not to increase activity right away. So some common causes of injuries is poor technique, not warming up, overtraining, incorrect equipment, an unsafe environment, which is like a weather or whether it's the surface, ignoring fatigue or pain in your body. So this safety checklist will kind of help you along the way to reduce injuries. So first you always want to do is start for a warm up for at least 5 to 10 minutes and cool down to 5 to 10 minutes. You wear proper clothing and footwear. Practice good hydration habits. Use the equipment correctly, and always, always, always listen to your body. So a warm-up prepares the body for movement. Its purpose is to increase blood flow, wake up the muscles, and reduce injury risk. So example includes like light jogging, dynamic stretching, mobility drills. Your warm-up should match the activity that you're really about to perform and do. So a cool down helps your body transition back to its resting state, helps to lower your heart rate, reduce soreness, and support muscle recovery. So examples would be include walking and also static stretching. We all know that hydration is very important because it helps with regulating your body temperature, preventing overheating during exercising, support muscular contraction, and prevent cramping. Even a 2% drop in body water can hurt performance and then definitely increase fatigue. And so here are the general hydration guidelines. So before activity, as recommended, drink 8 to 12 ounces of water an hour before exercise. Um, excuse me. And then optional, do 4 to 8 ounce 10 minutes before starting. And then during activity, sip 3 to 6 ounces every 15 to 20 minutes. And after activity, drink until urine is like yellow. If sweating heavily, consider electrolytes. Students should sip water regularly and not chug. When exercising in warm or humid conditions, avoid extreme heat and humidity. Take breaks in the shade. Wear light and breathable clothing. Check on like your classmates or others that you may be working out with. Remove sweat-soaked clothing if overheating. Never push through dizziness or nausea if you're feeling like you're about to puke. Heat-related illnesses can escalate very, very quickly and become extremely, extremely serious. So please always take precaution. For signs of heat-related problems, so heat cramps, so you get muscle cramps, excessive sweating, heat exhaustion, so pale, cool, clammy skin, headache, nausea, dizziness, and rapid pulse, a heat stroke, which definitely requires medical emergency as well. Hot, red, dry skin, confusion, fainting, or no longer sweating. So at this point, you want to like stop activity immediately and get help as soon as possible, like immediately. Please stop activity if you are experiencing any headaches or dizziness, chills in that hot weather, nausea, feeling unusually weak, heart beating too fast, confusion, or trouble thinking clearly. So one of the indicators too of like, to tell whether you're dehydrated or not, is to check urine before activity. So very light yellow means you're hydrated. Dark yellow or amber is like you probably need to drink water before starting. Brownish is to stop and basically hydrate yourself. And when to cancel and modify outdoor activity. If the temperature is above 95 degrees Fahrenheit, heat index is above 100 degrees Fahrenheit, high humidity prevents sweat from evaporating, and poor air quality or no shade is available. And so it's also important to use equipment safely. So check for damages, use proper size of equipment, follow instructions, ask for help if you're unsure. Examples would be correct running shoes, helmet fitting, or weight training safety. And so also when exercising, please always consider environmental conditions, so temperature, humidity, wet or uneven surfaces, or indoor versus outdoor conditions. Your environment affects how safely you can exercise. So just be aware of the environment that you're trying to exercise in. I think it's important for you guys to know, like, recognizing warning signs when exercising. So stop activity if sharp or sudden pain. If there's dizziness, if you're experiencing numbness and tingling, or joint instability, or extreme fatigue. Pain is not something to push through. Just please listen to your body. And so to reduce injury risk, we follow gradual progressions include rest days, cross train to avoid overuse, use proper form, balance workout routine, consistency with safe habits matters more than the intensity of the exercise. So it's important for anyone, students, athletes, or, healthcare professionals, anyone to know who to call, location of AED, how to report an injury, basis of first aid without practicing like medical procedures. You're not performing medical procedures, but you should know how to respond responsibly. So let's walk through a few scenarios. So one is a classmate shows signs of overheating. Someone uses equipment incorrectly. A student sprains an ankle during a basketball, and it starts raining on an outdoor day. We'll discuss the safest choice in each situation. So please be thinking about these scenarios. So for your exit ticket, what is one new safety rule you will use, and what is one sign of injury students should never ignore? And also for your homework reminder, please complete the safety scenario sheet and your safety assessment checklist, please. This will be due Friday at the end of the week. So please make sure you complete those. And as always, students, I have a list of references here, and I'm always here for your support and answering questions. So please let me know if you need me to clarify something. Thank you.